Today is Father's Day, so many of us are getting to spend some time with our dads, and wanting to keep our dad with us as long as possible brings to mind what sadly is the second leading cause of cancer death to men, prostate cancer. So joining us today to talk about prostate cancer awareness is Dr. Deepak Kapoor, president of the Advanced Urology Centers of New York. Doctor, welcome.
Thank you, Pete, and thank you for having me on to talk about this important subject.
Dr. Kapoor, it seems like it would be common sense that early detection of cancer saves lives, but with prostate cancer, there seems to be some controversy.
Yeah, Pete, you're absolutely right, and that's one of the things that really frustrates those of us that take care of this disease. You know, back in 2010, a government agency known as the USPSTF issued recommendations that no man, regardless of risk factors, should have screening for prostate cancer. They finalized those recommendations in 2012, and unfortunately, over the last 3 years, we've seen a dramatic decrease in the number of men that have had PSA testing, as well as a decrease in the number of men diagnosed with prostate cancer. Unfortunately, what's happened is that it's not only low-risk cancers that we're missing. We're finding that men with very significant prostate cancer are not being detected because their screening has been delayed. We have a lot of problems with that one-size-fits-all approach to cancer detection. And in fact, President Obama himself seems to have a problem with that because only 1 week after the USPSTF issued their recommendation, the President of the United States had a PSA blood test done.
What would your message be to a middle-aged man listening who, say, hasn't been tested and is unsure when to get tested for prostate cancer?
The message to men right now is that we have the ability to create very highly personalized screening strategies for men. No man should wait for a government entity or another or someone else to tell them what to do with their own body. My strongest recommendation, supported by international guidelines, is that every man get a baseline PSA sometime during their 40s. Once they have the results of this baseline and using that result, take into account the risk factors that they may have and come up with a personalized strategy for early detection.
We're joined again by Dr. Deepak Kapoor. Doctor, tell us about Advanced Urology Centers of New York.
Advanced Urology Centers of New York is the largest urology practice in the United States. We do almost 20% of all the urology in the state of New York and a significant percentage of all the urology done in the country. All of our partners are board-certified physicians. We have 55 offices in 8 counties in the greater New York metropolitan area, so no man is more than a couple of minutes away from one of our offices and world-class urological care.
And where can men go for more information on this subject?
The best place to go is to our website, which is www.aucofny.com. That's www.aucofny.com.
Thank you for your time, Doctor.
Pete, thanks again for helping me inform your listeners on this important subject on this Father's Day.